As an esthetician, I do see a lot of scars around the nose when I'm doing extractions for blackheads. And if there's the option not to have scars at all, why not? Being young, kids are mean. I got bullied in elementary, so it's something that I wanted since I could remember. There was always the option to go cheap, go to Mexico, and now at my age, at 35, I finally had the savings to choose a good doctor. And I feel like I have one of the best doctors available. I don't feel like I was going to be treated differently for not being a celebrity in Beverly Hills. But he really was like that. He made me feel really welcome, just as a regular person. I'm looking forward to wearing a beanie and not feeling self-conscious, wearing my hair up in a bun and not feeling self-conscious, being at a restaurant if someone looks over at me, not feeling like they're staring at my nose, feeling a little bit more comfortable with being looked at. I'm just feeling excited to be more comfortable within myself.
So today we're working on Jennifer's nose. She's a gorgeous esthetician here in Beverly Hills who is already herself an expert in facial anatomy. And so it's really a privilege and an honor to take someone's face like hers and improve it and contour it. With her side profile, as you see, she has a very strong dorsal angle, not just high up, but also low down, that's making the tip of her nose really plunge, especially when she smiles. We're gonna shave down that side profile today with our closed scarless rhinoplasty approach. No external cuts, no external scars. This is the preferred choice for most actors, actresses, singers, people of public figure and interest because they don't want any external telltale signs of surgery. We're also going to, in her case, sculpt the nasal tip to make the tip a little bit less bulbous and then also rotate the tip up so it doesn't droop as much. So 3 major maneuvers. While we're in there, we'll also take a look at her breathing and do anything that needs to be done to improve her breathing. And we'll also finesse any other parts of her nose to holistically make it look the best version of her on her own face. Still want it to be a Jennifer, not a Dugar.
This is just infiltration of local anesthetic to topically numb the nose and vasoconstrict the blood vessels. So here we are making our first cut into the mucosa, and then we're going to dissect along the mucosa to expose the cartilage of the septum. And now what we're going to do is we're going to shave some of that cartilage of the septum out. And by removing this piece of cartilage, we allow the nose to rotate up more. By moving just this little strand of muscle, we're able to decrease the amount of pull that her nose has. So now what we're doing is we're cutting a small piece of the vestibular mucosa. By removing this piece of skin along with the cartilage and the muscle, these 3 maneuvers allow us to rotate the nose upwards where we stitch it all back together. So here we're making our intracartilaginous incision, and what we're going to do first is make it through just the mucosa. Then you're going to see now what I'm going to do. I'm going to dissect the mucosa off of the underlying cartilage. The underlying cartilage is this white bluish tissue underneath. That is the cartilage of her lower lateral cartilages, which make up the tip of her nose. Now we're going to make an incision through these tip cartilages to remove the cephalic edging. You can see the cartilage now poking out. And now we're going to hold the mucosa on this side and on the other side. Now we're going to remove this cephalic margin of tip cartilage. So this is the piece of removed cartilage that you take out from the tip of the nose. By removing this segment of the cartilage, we refine the tip to make this part of the tip look much thinner and much less bulbous. And then we're going to dissect in a subpericondrial plane to then expose the cartilaginous profile of the nose. So this is the dorsum of the nose. This is what makes up the side profile of the nose. So this is how we dissect the dorsum of the nose in order to give us access through a closed approach. So everything's done from inside the nose, so we don't have to cut or make any external cuts or scars, and yet we still have access to the entire dorsum of the nose. So what we're going to do now, we're going to carve some of this really strong profile out of the nose, and we're going to use mucosal preservation techniques in order to preserve the mucosa so we don't harm the natural physiology of the nose. So this is the cartilaginous profile that we're removing in order to then have a softer version of her same profile. And then we'll clean up the edges just to make it as smooth as possible. So this is the piece of cartilage removed from the side of the nose. And by removing the cartilage from the side of the nose, we're able to get the softer, more elegant appearance of the side profile. You see, we saw the bump right here. So now we're gonna go for this dorsal bony hump that's still remaining. I'm gonna engage this gouge osteotome at the junction of that bony dorsal hump, and I'm gonna just gently carve, just like carving a piece of marble, just gently carve this little piece of bump out. And what I remove is just as important as what I leave behind. And so that's why the base of this instrument is very smooth and sharp in order to give a pure, clean cut to the edge of the bone underneath, so it's nice and smooth for the rest of our life. And go for it. Uh-huh. 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 Good. So then this is the piece of bone that was sitting right here, making this part of her dorsum a little strong. So now we removed this piece of the bone, and we're allowed this to become much smoother, top to bottom. Okay, we did all the segments that we removed. So we removed the tip cartilage, removed the dorsal bony hump, removed the cartilaginous bony hump, removed the caudal-septal shave, and remove the other sided tip shoe. And that's what allows us to get this soft entware. Get it? This is called a rasp. This is a file for the nasal bones. From our closed approach, we're able to access the nose from inside, and then we use this to file down the edge of the bone. We're able to remove small segments of bone to soften the nose. This is to allow the nose to be as smooth as possible after surgery.
You know, it really wasn't too bad. I think the first day was definitely the most uncomfortable. After that, it was pretty easy. I hardly had swelling. I just followed all the instructions. It was pretty easy. I can't complain. I can't believe it's been a week.
You ready?
Okay. Yes.
Take this thing off. That's sure.
I'm so excited. Oh my god. I'm gonna start crying. I just can't believe this is me. I like have no words. I'm just really happy. I should have come to you sooner. It took too long. I feel like it's still me. Oh my gosh, I love it. It doesn't droop when I smile.
Yeah, it's really cute.
Yeah, I
It's
like
really
it.
cute. It's only gonna get better and better.
Yay,
This
thank
one
you.
version, you're welcome.
Wow.
Now that you saw your results, what do you think about your results?
I love them. I can't complain. It was really emotional. I'm just really happy with our results. I kept hesitating to find a doctor, and now that it's done with and I went through it all, it's just like, why did I live so long with so much discomfort? Should have done this a long time ago, but I'm really happy overall. I know this sounds silly, but I've always felt uncomfortable wearing a beret. And I'm really excited to put one on now. I want to go buy one and put on a cute little French beret and go get coffee or something. That's what I'm excited about to do first. It's been about 6 weeks. It's been going great. I've just passed Christmas and New Year's, and I got lots of compliments, and it was the most comfortable I've felt in a very long time.